evening, and thank you for being with us today. I'm Michelle Samaritan from Somerset County Department of Health, and we're here because I guess everybody wants to learn a little bit about mosquitoes and ticks and how to protect themselves. So I'd like to welcome you on behalf of Dr. Paul Masaba, who's the Director of Health of Somerset County, and he covers Franklin Township, which we're here today. So we'd like to talk a little bit about our Fight the Bite initiative. And as part of this, we brought in some speakers with us today, and I'll introduce them as they come up. But the first one I'd like to bring up with us is from Rutgers, the Department of Entomology, Scott Kranz. He is our local expert on mosquitoes and ticks and things that fly and bite. So I'll hand the microphone over to him and let him take it away. Please help me welcome Scott.
Thank you very much. Okay. I've actually been in and around insects my entire life. My father was a professor at Rutgers. When I graduated college, I took a job in Sussex County, New Jersey, and I actually directed their mosquito control program for 12 years. So I've got that on-the-ground experience. When the opportunity came up to come back to Rutgers, I took that opportunity, and I've been working in the Center for Vector Biology now since about 2001. So we came through West Nile virus, if you may recall. That was a problem that was successfully managed, at least from my perspective, here in New Jersey. We're looking at another arbovirus, mosquito-borne virus. That would be Zika right now. And most of my presentation is going to focus on the Zika aspect with regard to mosquito control now. What I'll wind up doing, I'll give you a brief introduction. I'm going to cover mosquito biology, the species distribution of the insects we're most concerned with right now. I'm going to talk a little bit about the organization of mosquito control in New Jersey, how that operation is undertaken at the state level and at the local level, and at the university level. I'll give you some insight on what our anticipated activity is locally. And then I'll turn it over to the Somerset County Mosquito Control Division for their local mosquito control program response, how they're going to go about, doing mosquito control at that local level. Should you have any questions, feel free to catch my attention. I'll be more than happy to pause and try to address that. And again, thank you very much for coming out. All right, so generally, the mosquito life cycle is divided into a terrestrial and an aquatic stage or phase. So what you see on the top of the screen here is a female mosquito depositing her eggs on the surface of the water. That would be that white mass. From those eggs, a mosquito larvae hatches. It goes through 4 different larval instars, turns into a pupa. That would be that comma-shaped creature on the lower left portion of the screen. Stays in that condition for a couple of days and then emerges into the terrestrial adult that most people associate with mosquitoes themselves. Believe it or not, many people don't make that connection to the female biting mosquito and that larval habitat that is often really close by. All right, female mosquitoes are the only ones that actually bite. And that's important. They wind up biting you because they need the protein in that blood meal to produce eggs. Both male mosquitoes and female mosquitoes will feed on sugar nectars to sustain themselves. So they'll come up to your plant, they can actually feed on the plant, draw the sufficient nutrient out of that plant. So male mosquitoes have no need to bite you at all. That sugar meal is used to sustain flight activity, metabolism, stuff like that. So to reiterate, it's the protein in your blood that female mosquito is looking for so she can produce eggs. And then she deposits those eggs in a suitable larval habitat, and the life cycle continues from there. Now, there are a large variety of mosquito larval habitats. What I'm showing you on the top center of the screen there is a temporary rain pool. Most of the time, that's just going to look like grass, no water at all. What you're seeing is a few tire tracks that have gone through there. This is after a rainfall, and that depression in that field is holding water. That water may persist for, a week, 10 days, maybe a little bit longer, but then it goes away. Lower left is the more permanent water that's associated with some mosquito species, so swamps and bogs. That water tends to remain there year-round, and often there's characteristic aquatic vegetation associated with those habitats. On the lower right portion of the screen, what you see is an example of artificial containers. But other species of mosquitoes will use both natural tree holes, plant leaves, things of that nature, or artificial containers, in this case tires, as a larval substrate. So the female mosquito will fly in there, deposit her eggs, and then the larval hatch and life cycle continues from there. So quite a variety of larval habitats, and they tend to be species specific. If you take all of the mosquitoes we have here in New Jersey, we've got about 63 different species right here in the state. Of those, about 15 of those species are a particular problem that need to be addressed. The rest serve mainly as biological curiosities. They're a food source for other animals. From our perspective, they don't cause us any problem at all. Now, if you draw a line, try to divide the mosquitoes in half, so to speak, you've got two basic kinds. There's a floodwater life cycle type. Those are the ones that take advantage of that temporary water in the previous slide. And you've got a permanent water life cycle type. Those mosquitoes need to have access to water or water the entire time. So floodwater mosquitoes tend to be your 80s. And permanent water mosquitoes, for our purposes today, tend to be your Culex mosquitoes. So an example of floodwater mosquito. In this case, the eggs actually have to go through a period of conditioning. We call that drying down. The female mosquito will come into that site, she'll deposit her eggs, usually on the moist mud or an area that either is wet or will soon be wet. Those eggs develop to a certain point, and then they stop. They actually can sit there in a state of suspended animation. That could be for a week, could be for a month, could be for a year, could actually be for several years. It depends when the conditions are next right for egg hatch. And that's a very important aspect of these mosquitoes. When they do hatch, so you get a heavy rain event, you have a flooding, that water sits there for long enough, there's plenty of food in the water, those eggs tend to hatch all at the same time. So what you see when you go and you check is you have a whole bunch of early instar larvae, all about the same size. As time progresses, they turn into pupae, all about the same time. And then they come off as adults, again, all at the same time. So from your perspective, if you were sitting out on your deck one evening, no problem at all. You're out, you're enjoying the evening, you're not having any nuisance from mosquitoes at all. You go out the following night, and you quite literally get driven inside. The mosquito nuisance is so bad, you just can't take it anymore. That's an example of a floodwater mosquito. Most of these floodwater mosquitoes are avid mammal biters. In other words, they're interested in taking a blood meal off of you. Now, in contrast with our permanent water mosquitoes, again, this is a generalized model here. In this case, the eggs are deposited directly on the water surface itself. If the water is removed from the eggs die. They can't survive at all. So it's very important that that water is going to be there for a long enough period of time that the mosquito can complete its life stage. And that could be a week to 10 days. It's temperature dependent and depends on where and what species. Some of these mosquitoes have what we call a tolerance to pollution. So they can survive in some pretty high organic environments. Culex pipiens is an example of that. People tend to create these habitats, and they tend to be relatively close to where we live. Sewage type systems, things of that nature. This mosquito does very, very well under those conditions, where other mosquitoes can't survive. So Culex pipiens has a selective advantage if there's a little bit of pollution in the water. The important part with regard to these mosquitoes is you have oviposition occurring every day or every evening. You have egg hatch every day. So you have all the various instars of the mosquito present in the water at the same time. So you have the really small mosquito larvae, big mosquito larvae, and pupae. You have adults coming off every evening. So from your perspective, you're out on your deck, there's a low level of mosquito nuisance. You know, you go back out the next night, same thing, low level of mosquito nuisance. It doesn't reach that extreme period that actually drives you inside generally. So it's very different. They never occur in what we call broods, succinct broods, as the floodwater mosquitoes do. It turns out that many of our West Nile virus vectors are in this group, and they're primarily bird feeders. So the Culex mosquitoes, 9 times out of 10, if given the opportunity, they'll feed on a bird instead of you. Whereas I was talking about the 80s mosquitoes, they're mammal feeders. So if given the chance, they're going to feed on a mammal as opposed to a bird. And that plays very different roles in the various diseases that cycle here in New Jersey and elsewhere in the nation. Okay, now what's really important is these overwintering mechanisms between these two basic life cycle types differ. Your floodwater mosquitoes overwinter in the egg stage. So when temperatures get cold, you get that first freeze. The adult mosquitoes themselves actually die. Males don't tend to live that long anyway, but the female mosquito perishes. With your permanent water mosquitoes, they actually overwinter as inseminated adult females. So the male mosquitoes die. The female mosquitoes at a certain point in the year will cease their blood feeding activity. They'll actually wind up feeding just on those plant nectars that I mentioned earlier, and they build fat body. Those fat body reserves are used to get through those winter months. So completely different life cycle. Their populations tend to start out slow in the spring, and they build throughout the summer season. So as you get into August, there are more and more and more of those mosquitoes. So lots of female mosquitoes enter the winter. A few, survive, come out, blood feed, develop eggs, and then start ovipositing. The difference there is your floodwater mosquitoes, all they need to do is hatch. So as soon as conditions are right, if it's warm enough and there's enough water there, all those eggs hatch at one time. So very, very, very different life cycle types. Okay, so floodwater mosquitoes use temporary pools, water that's there and gone. Permanent water mosquitoes, they need access to water all the time, so that water tends to be there year-round, and again is associated with specific aquatic vegetation. Easily recognizable if you know what you're looking for. And then it turns out that both of these life cycle types can take advantage of the containers, both natural and artificial containers. So what you have in a tire, for instance, is you'll have water levels that change. So the mosquitoes will come in, they'll deposit their eggs right at the top of that water line, and as the tire dries down, you get this band of eggs around that larval habitat. Then it rains, tire fills up, eggs hatch. Since the water is there, it's kind of a protected environment, your permanent water mosquitoes will also take advantage of that. So they will have those persistent and consistent generations going throughout the summer. So what you've done, if you have this kind of habitat in your backyard, you've actually given the mosquitoes pretty much everything they need to complete their life cycle. And that's one of the points we're going to drive home this evening. Now, in New Jersey, mosquito control is actually mandated by state law. And that's because mosquitoes transmit disease, they cause nuisance, and they have the ability to impact the economy of the state. When these laws were passed, the problems that kind of brought this to light were diseases like yellow fever and malaria. Not something that people think about a lot right now in our area. You may be a little more familiar with Eastern equine encephalitis or St. Louis encephalitis, or more recently, West Nile virus, chikungunya, Zika, and perhaps dengue. Those are in the press more recently, but in reality, they're just reminders of the need for mosquito control. That's why those laws were passed in the early part of the 1900s. All right, so how is mosquito control organized? Who does what, so to speak? The bulk of everything that gets done is done at the local level. In New Jersey, based on law, county programs have that responsibility. So they get funding from the local freeholders to actually run a mosquito control program. Another leg in this three-legged stool, just for an analogy, would be the agricultural experiment station. They have a role. They helped establish the mosquito control laws, and they provide a lot of research and extension type work. And then you have what I'm collectively calling the state. On the slide, I'm using an example of the State Mosquito Control Commission. And that's made up of members of the experiment station, the State Department of Health, State Department of Ag, New Jersey Department of Environmental Protection. In addition to those members, there are 6 public members that are appointed by the governor. And together, they form the State Mosquito Control Commission. With all of these folks working in concert, it's been the balanced professional approach for New Jersey mosquito control that's been in existence since about 1912. It's functioned quite well, and it's done a very good job at reducing mosquito-borne disease and mosquito nuisance here in the state. Everybody has a role. If everybody does that work, things usually progress fairly well. Okay, so moving on to the topic of the season is Zika. Now, it's been around for quite some time. It was actually discovered by accident. It was part of a yellow fever experiment that was going on in Uganda. It turned up in a monkey. They isolated it, published that work, and we really didn't hear much about it for some time. It wasn't until later that the disease showed up in humans, and then it was still in Africa, and then since has trekked around the globe. So this slide just kind of shows you, that progression. And to be quite honest, there wasn't a lot of attention given to Zika until you get over to number 4, which is like 2007. That's when it really jumped on our radar screen. There were these chikungunya events that were going on, and every now and then you'd hear about this disease, Zika, that was showing up as well. A relatively mild disease, normally. You have a fever, some joint pain, red eyes, etc. Previous slide had some of those symptoms on there. And you look at 2013, that's number 5 over there, the epidemic in French Polynesia. Again, kind of grabbed our attention a little bit more. And then, of course, the most recent situation that's going on in Brazil, which has kind of captured the public attention through media right now. And it's because of there's a select group in our population, namely pregnant women, who are having really poor birth outcomes, when infected with this disease. And it's kind of grabbed, our attention. And a ton of research is going on Zika, and we're learning new things every day. So it's becoming, more and more important from that perspective. And we're learning new things. That's an evolving situation. So if you heard some information on it a few months back, that information may have changed as, new evidence comes to light. What you need to talk about when you're talking about these arboviral diseases are the mosquitoes responsible for spreading those diseases. Namely, there are 2 that we're concerned with here, Aedes albopictus and Aedes aegypti. And what I'm showing you on this slide are the old CDC maps that showed the distribution of those mosquitoes in the United States. We wanted to update this information. So CDC sent out a survey, it was widely distributed, and many people actually submitted data that they plugged into their models and developed a new set of maps. And this has gotten a lot of attention most recently, because if you pay attention to those 2 maps, what you've seen is a northward expansion of both mosquito species. At least that's what it looks like. This is CDC's best estimate of where you might find these mosquito populations. In other words, the conditions are sufficient to support these mosquito populations. The earlier set of maps are probably more representative of where you're actually going to find the mosquitoes. These maps are where you might or could find these mosquitoes. And with this northern expansion, obviously, it's gotten a lot more attention. And I think the biggest portion of that is people just misinterpreting what the maps actually say. And if you read the text, they explain, what the criteria is quite clearly. But with the attention to the poor birth outcomes, with Zika in the media all the time, it's kind of leading into this situation that I'll call Zika fear. So there's, a lot of attention on it. Some of it's warranted depending on where you are, and some of it may not be. So I'm going to try to give you some insight on that from my perspective. Now, what I'm showing you here is actually where dengue has been. The map's from 2013, but it's where we've seen active dengue transmission. And namely, it's between those two lines. So if you look at those two lines, north of that, you tend not to see local dengue transmission. And then, south of the southern line, you have the same situation. It turns out that dengue is vectored by the same mosquitoes that we're concerned with Zika right now. So Aedes aegypti and Aedes albopictus. And these are the areas where the mosquitoes have been able to spread that disease quite effectively, which is significantly further south than the species distribution maps that you saw in the United States. So why is that? Why would we be seeing that difference? My guess is if we see Zika transmission, more often than not, it's going to be within this area. And if you actually take a look at where active local transmission of Zika is occurring, it's occurring in these same areas. Because it's the same mosquitoes, similar epidemiology, similar things at work. All right, so why am I thinking we're not going to have, hoping, fingers crossed, this is an evolving situation, we're not going to see widespread Zika transmission in the U.S.? And it has to do largely with our living conditions. What I'm showing you here is an image from Rio. You've got the high-rise community right there, and right below it, you've got the low-income housing. And if you could see that photograph clearly, what you have is an open environment. No windows, no screens, plenty of opportunity for mosquitoes to come in contact with people. If you really focus in on the picture, what you'll see are all those blue containers. It turns out this area is having a water problem. They don't have plumbing. So they need to actually store the water that they're going to use. So those blue containers are these really large water holding containers. A portion of those are larval habitats for container breeding mosquitoes. They're the ones that I was talking about earlier in the presentation. So what you've got now is you've got plenty of larval habitat and lots of people with exposure to those mosquitoes. So there's a lot of mosquito biting going on people. So it's ripe for disease transmission if there's a pathogen that's introduced into that system, and if you have a naive population, in other words, a bunch of human hosts in this case that haven't seen the disease before. It can kind of take off and you get this explosive transmission that takes place. Just to picture zooming in a little bit closer, to give you a pretty good idea of what's going on. So you see on the top of that roof, there's a water holding container right there. An individual, no door, in some cases, no windows. That's the living conditions. So these folks are exposed to mosquitoes literally 24/7 throughout the day. And I think that's why we're seeing the kinds of transmission that we're seeing in those areas. It has a lot to do with the living conditions and the lack of organized professional vector control or the public health infrastructure. Our situation here in the U.S. is much better, in that regard. Just another image showing you, the open environment. In this case, what you may or may not be able to see is a picture of a baby that has microcephaly. That's the father holding it, the mother standing to the right. But what I think is probably a little bit more important to our conversation this evening is the dog that's actually in that picture. Because it turns out the behavior of the two mosquitoes that we're talking about or focusing on today are actually a little bit different. And this will come into play a little bit later on. Now, what they're doing in Brazil is they're trying to kill the adult mosquitoes that may be infected. And it's the appropriate response. They're adulticiding, basically spraying insecticides in the air. They're going to come in contact with the mosquitoes and kill them. They're doing this both outside and inside. It turns out one of the mosquitoes that we're concerned with, Aedes aegypti, likes to come inside. So it's a pest outside, it's also a pest inside. Often the people are providing the larval habitat inside their homes, and the mosquito takes advantage of that. So you have to try to kill the mosquitoes that are inside the house as well. This is actually an image of a school. So what you see in this situation is, insecticide application in the school setting, and it's actually warranted in this situation. I don't believe we'll be seeing things like that here in the U.S. I don't think there will be a need for that. Okay, so when we're talking about two mosquitoes now, they tend to be the floodwater mosquito type. It's a container ecosystem. Both Aedes aegypti and Aedes albopictus take advantage of the larval habitats that are both out there in the environment naturally, tree holes, or are refuse. So I'm just showing you some examples. Some pans, you see the cemetery vases, you see the tire piles. These are all things that you don't want to see near where you live, play, or work. There are endless examples. It turns out they don't need a lot of water to complete that life cycle. Again, the water just needs to be there for a week to 10 days. That's not a long time. So if you have a larval source, you could literally be breeding the mosquitoes in your backyard. Just one more example that wasn't on that previous slide. I don't know if anybody's seen this. It's one of those gutter extension tubes. Take the rainwater off your house, move it away from the foundation. All of those little dimples in that tube that allows you to bend the tube hold a tiny amount of water. And Aedes albopictus loves that habitat. It'll get in there and deposit eggs throughout that tube. And it turns out those eggs can survive the winter. So you have a population from year to year to year in your gutter extension tubes. And it's something that's really, really hard for organized mosquito control to do anything about. Because they would need to be in your backyard. They would need to know that's a problem. And somehow they'd have to figure out how to treat it, which is a difficult task. Okay, so a little bit about the two mosquitoes themselves. What I'm showing you here is Aedes aegypti. This is the primary vector for Zika virus and a number of others. It tends to be an urban mosquito. In other words, it does really well in the urban setting. It has a selective advantage in that urban setting. It will use containers. It's a day-biting mosquito, so it's active all day long. It shows activity peaks at dusk and dawn, like many of our mosquitoes do. But it will also feed at night if you provide yourself. So it's opportunistic in that regard. It is endophilic, meaning it comes inside, something that I mentioned earlier. And it's anthropophilic, meaning it likes to feed on people. So think back to that photograph I showed you with the mother, the father, the young child, and then the dog. If presented with either of those individuals to feed on, Aedes aegypti is going to select a person. That's what it wants to feed on most of the time. Now that's a little bit in contrast with Aedes albopictus. This is the Asian tiger mosquito. This mosquito is present here in New Jersey. It's throughout the entire state. It's been here since 1995. We have done our best to manage the mosquito population, and it has done its best to elude our efforts. So it's found throughout the state. It's a very highly adaptive mosquito. It's also an invasive mosquito. It takes advantage of natural and artificial containers, examples of what I showed you just a few minutes ago. It tends to be both rural and suburban. If you have a competition with this mosquito in the rural setting, Aedes albopictus actually does better, and it can outcompete Aedes aegypti. If you move that into an urban setting and then turn up the heat, Aedes aegypti does much better. So South Florida, South Texas, Aedes aegypti wins that competition battle, which is problematic because it's the primary vector of the disease we're concerned with right now. Like Aedes aegypti, it is an opportunistic day-biting mosquito, so you present yourself during the day, it will come and feed on you. It too has dusk and dawn activity peaks, and will feed throughout the night if you present themselves. So you really need to protect yourself from this mosquito 24/7 to prevent feeding the mosquito. One thing that works in our favor here is it tends to be more of an outside mosquito as opposed to an inside mosquito. It will enter dwellings, but most of these populations tend to be outside. So you would go outside into your garden. That's where you would experience the nuisance. Mostly during the day, but again, also in the evening. It too has a wider host range. Excuse me. Meaning, if you think back to that image I showed you earlier with the mother, the dog, and the father, Aedes albopictus is going to feed on whatever is most convenient, which is really important because every time it feeds on something other than a human, that's a wasted possibility to spread Zika virus, so to speak. So if the mosquito feeds on a dog instead of a person, it's not as efficient a transmitter of the Zika virus. So we have that working in our favor. But it does feed on, people as well. All right, so in February, just when we did this in general, we brought all the mosquito control biologists in around the state. We reviewed the biology and the identification of both of these species. So these folks know what they're looking for with regard to the mosquitoes, and that's really important. Now, a little bit on the transmission cycle. It's a little bit more complicated than a mosquito just feeding on a person and then feeding on the next person and transmitting that disease. There's periods of time that need to go by. So if a mosquito, for instance, takes its first blood meal on an infected person, acquires that virus, there's a period of time, it's about 10 days, give or take, it's temperature dependent, before that mosquito is able to transmit that disease. It's called an extrinsic incubation period. Now, when that comes into play, the important part is on the second blood feeding, even if it's on a person, the mosquito might not be able to transmit, which means it has to go lay those eggs, wait a period of time, come back and feed again before it can actually infect an individual. And then the individuals themselves need a period of time to develop the infection to, in turn, infect the mosquitoes. That would be the intrinsic incubation period, what's going on inside the person. And that, with Zika virus, is about 3 to 7 days. So you can see there's a lag each time this happens before you get these, transmissions that kind of take off. And then, of course, there's the time it takes the mosquito to complete its gonotrophic cycle, which means the time from blood feeding to egg development to egg oviposition, and then blood feeding again. And that's a little bit different, again, based on which mosquito we're talking about and, temperature. Okay, so how does Zika get around? Most of what we were talking about was on the top part of that illustration. It had to do with mosquitoes biting people, transmitting the disease, and picking up the disease from people and infecting more mosquitoes. Since Zika hit the scene, we now are aware of several other modes of this virus, being transmitted. And it's through sexual transmission from male to female, or from an infected mother, to her unborn child. That complicates things a little bit because it's more than just mosquitoes. And the public health response to that, is designed to help protect everybody under all circumstances. So most of what we're doing in the mosquito control side has to do with the mosquito people. In other words, lower levels of mosquitoes around people. And that's why, if you go back to the statutes, why mosquito control is mandated right here in New Jersey. Okay, so this has resulted into Zika action plans. It's CDC-driven. We are in pretty good shape here in New Jersey because we have organized professional mosquito control. We've been doing this for a long time. Many of our systems that are in place are appropriate to address this problem. And it's just a matter of planning ahead, having the resources, getting out there and doing that work. And it depends on where you are in the country as to how prepared you are to try to address this problem. All of it goes back to resources, and a big part of what we do has to do with public education. If you kind of connect the dots with everything that I've been telling you, people can do a lot to control this, the potential for disease transmission right here in the U.S. It's just a matter of managing the mosquitoes in your backyard simply by not providing larval habitat for the mosquitoes. If you remove the water, you actually remove the mosquito problem, and that's a key point. So, what have we done here at the Agricultural Experiment Station? We reviewed the biology of the potential Zika vectors here. We have certified mosquito identification specialists working in all of the counties. Most recently, we certified new 10 biologists just this past year. These folks have had to pass an extensive certification exam. It's actually a very rigorous exam. It's, not hard to, it's actually very easy to fail. It's hard to pass. They have to get a 90% or better. So they're given a mosquito, they have to correctly identify it, and then they have to correctly answer a series of questions on both its biology and control. So it's a fairly high bar. We are disseminating the most recent information as it becomes available. So as new research comes out, that research gets out into the hands of the folks that can actually use it. We're also working very closely with both the federal and state representatives, trying to manage this potential problem. And we've requested funding from a variety of sources to help improve the vector control training, even at the national level. So if those funds get approved, we expect to ramp those things out this season, and we're in a position to do that. Here, I think what I'll do is turn it over to our colleagues from Somerset County and have them talk about, the local mosquito control program response.
How are you? I'm Glenn Jerzak with Somerset County Mosquito Control. In Somerset County, mosquito control falls under the Road and Bridge Division, where we have multiple workers and foremen. All of the foremen, all of the general foremen, they're all licensed applicators. Every year they go for a recertification course to keep up to date on all the aspects of mosquito control. All the workers that we have, 20 of which are licensed. Our season begins April 1st and it ends the end of October, October 31st. During that time, 6 workers are dedicated full-time to mosquito control, and 2 foremen, Frank Culver and myself. Of the 6 workers that are doing that full-time, 2 of them are for surveillance, and the other 4 are what we call our inspectors. They'll go out and we put Somerset County in the crosshairs, and you come up with 4 sections. Each individual worker has an assigned area. At this time, we have about 985 known areas for mosquitoes. That's the ones that we can control. That's the ones we're aware of, we have mapped out, we have historic information on, and we treat them on a regular basis. Average, about 2 to 3 weeks, the inspector will get around his whole route and hit all of those locations. The parts that we can't do is, like Scott was saying, we can't go into everybody's backyard. We can't find all the containers, all the buckets, the wheelbarrows, the flower pots. There's just a multitude of containers out there that people don't even think of. Your recycling bucket, things like that that hold water. It doesn't take much. A cap full of water will breed mosquitoes. The 2 workers that do the surveillance, one of them is in charge of all the light traps that we use. It's a New Jersey light trap. We have 12 of them throughout the county. They're in the same spot all year, every year, year after year. What that does is it provides us with historic information, shows what type of mosquito we have at a given location, what time of year that mosquito was there. We can track and see if it's moving north, south, east, if it's going over towards Morris County or Middlesex County. We have that information from quite some time ago. Those mosquitoes, They're picked up 3 times a week, Monday, Wednesday, and Friday. They're brought back to the lab at South County, our facility. They're sorted and they're identified. We take those counts, all that information, we enter it into our database, and then we send the information over to Scott at Rutgers. They receive it from Somerset County, and they receive it from the other 20 counties throughout the state. So they have the entire picture of what's going on at any given time in the state. The other gentleman that does the surveillance is in charge of our gravitraps. Gravitrap is pretty much the same purpose as the other one. It provides us with historic information, different locations. We have 135 areas that we use these traps at. They're also important because these are the traps that we can detect virus with. These mosquitoes are caught. The gentleman will go out during the day, he'll set the trap, leave it out overnight, and retrieve it the following day. When he picks it up, he puts it onto dry ice that preserves the mosquito, slows down the deterioration of the mosquito, and it also slows down the deterioration of the virus if it's present. Same thing, he'll bring it back to South County to the laboratory, sort them, identify them, put them into a sub-zero freezer, and we hold on to those. Once a week, they're sent down to the state police lab, the state health lab at state police headquarters in Trenton, and that's where the testing is done to see if there's virus present. We know that there's certain mosquitoes that have virus and certain mosquitoes that do not carry virus. So when they bring them back in and we're sorting them out, we set about 40 traps a week. Maybe 20 of them are worth testing, the other 20 just become data. If we get when we send them down to the state police lab, they'll test it, they'll give us the information back, usually with a 3-day turnaround. Meaning if we sent it out Monday, by Wednesday we know if that was a positive or a negative, and they will tell us if either way. So we know it was negative, and we also know if it was positive. If it's positive, we'll go out to that area, check that entire area for any egg breeding habitat, treat the area accordingly, set up additional surveillance, meaning I'll set another trap right where that one was, and we'll start surrounding that area. Was it an isolated problem? Was it one mosquito? Are there more? Is it spreading? Is it moving? If it was the one, fine, problem solved. If not, then we have to take additional measures. If the area is out of control with mosquitoes, meaning our guys can't even go in there without getting bit, they're putting their mosquito nets on, we're getting a lot of residential complaints, we have a couple positives, then we have the capability of going in with the ULV machines, which is what everybody remembers riding behind the truck with the fogger. We have about 5 of those ready to go at any given time during the season. They have to be calibrated every year. We set them up, and that assures that we're using all the pesticides according to the label rate, which is very important, because label rate on any pesticide, that is the law. Can't swing past that. The other 4 guys, they're the route guys. Like I said, they have about 985 stops. They're going to go around, they're going to treat everything. They're going to treat all the swamps. They're going to treat all the temporary rain pools that Scott was talking about. They know where they're at, they're mapped, they're historical. We'll receive different calls throughout the year from residents complaining about standing water here or standing water there. We respond within 24 hours. We will have somebody there answering that question or concern in person within 24 hours. So if you have any problems, call us. That's what we're there for. We can take care of it. We have a multitude of machines and equipment to use. We have pickup trucks, we have backhoes. We treat drainage ditches that dry down and the water doesn't move too good. We take care of those. We will check everything out for you. What else did I have here? With Somerset County, we have a very good working relationship with our neighboring counties. Frank and myself, the 2 foremen, we attend regular monthly meetings with Scott Kranz, the Associate Executive of New Jersey Mosquito Control. Every month we meet, we exchange information, throw ideas past each other. Everybody's aware of what's going on everywhere in the state at any time. If Middlesex has a problem and they're coming towards the border with Somerset, hey Glenn, we have a problem over here, you might want to check this out. In return, I'll do the same with Union County. Hey, we have a problem over here. Check your side, make sure you're okay over there. Don't know if it's ours, don't know if it's theirs, but we're all out for the same reason. Frank and myself, like I said, we go to these meetings every single month. I don't think we've missed one yet. Other counties have a pretty good record, but Frank and myself, we go every month. We're dedicated for this. This is what we do. This is my reason for being here. At the end of each season, we take the entire season and we make a report, a detailed report as to what happened in Somerset County, when it happened, if we could figure out why it happened. We compile all the data from all the testing that we did, all these different sites that we treated, how much pesticides we used, and we send that information off to Rutgers, to the Dr. Goodman, the Dean of Agricultural Experiment Station. We also send it over to Scott, and then that wraps up the season with that, and it also gives us an estimate and what we plan on doing the following season. What did we learn this year that we're going to have to use for next year? At the end of the day, it's our goal to provide everybody with a reasonable amount of mosquito control to protect everybody from virus and nuisance. Any questions? That would be a regular daily operation in Somerset County. Michelle?
And thanks, Glenn. Now, these gentlemen have kind of showed us a little bit about what mosquitoes are living in our area. Ooh, got a few more of your slides here, Scott. See if we get past them real quick. Anyway, these gentlemen have showed you what types of mosquitoes are in the area, what kind of activities are going on, both at the state level and at the county level. And again, counties covering Franklin Township regarding these specific mosquitoes. But now, probably want to talk a little bit about what it is that you can do. There we go. We can talk a little bit about what it is that you can do. Because as they're talking about, there's all kinds of things in your backyard and your neighbors' backyards. What are you seeing, and how does this affect you? Which is the purpose of today's presentation. Now, these gentlemen concentrated on mosquitoes. Another thing I want to talk about just a little bit is that some of the protective ways and things that you can do to reduce the mosquito population in your backyard and to reduce the mosquitoes coming after you are also effective for ticks. So you might get a 2-for-1 on this one. Scott did a great job about talking about the different types of mosquitoes, went into a bit about Zika virus. There are some other types of diseases that you may get and see from mosquitoes. West Nile is one that's been pretty prominent within our state within the past 2 years. Zika, he's talked about. Chikungunya has been a little bit on the rise, and that's another one that we're worried about. And encephalitis. 3 of these, the first 3, the West Nile, the Zika, the Chikungunya, they kind of will affect you in similar types of ways, headaches, body aches. Encephalitis is going to affect your brain. So we're a little worried about that from a public health perspective because we don't want folks getting sick. Ticks, on the other hand, have their own particular diseases that come with us. Lyme disease is the primary one that we're really concerned with. Lyme disease first discovered in Lyme, Connecticut, named after that particular region, and it pretty much is rampant in our area. Somerset County is really high in Lyme disease, so we really want to educate more folks on what types of things you need to look for and how to reduce that. A few other diseases that can come from ticks, but certainly much less in New Jersey: Rocky Mountain spotted fever and tularemia. So we looked at the creatures, but what about your particular backyard? And this is whether or not you're lucky enough to have a freestanding home with a nice big green lawn, lots of trees and bushes, or whether you're in a condo that just has a little common area outside. You still want to keep an eye out for what types of things are there, because there are simple things that you can do, whether you're a landowner or not, that can help reduce the risk of mosquitoes and ticks in the particular property, because these are biting insects, and thing we want to do is make sure we get at them early, because the least effective way to take care of a mosquito is to do the slap. And I love that Scott came before me because he addressed a lot of this, and we'll just circle it back onto your own property, that standing water is a place where mosquitoes are likely to sit and lay eggs because they like water that just stagnates. And after rains, and Scott showed a picture of the tires going through a particular yard, this one could be just some type of a little ditch. If this is in your yard, a few easy things to do with it. You want to dry it out. You can sweep out the water. If it's a permanent ditch, you can fill in the ditch. If it's smack dab in the middle or on this one on the side of the yard, if you see that it happens that way, you can try planting right in there. Let the plants be able to absorb the water and use that as a berm and as a intervention rather than just let the water sit there. Mosquitoes can hatch in a week or less, and Scott really went over that, as to where something like this can breed a whole lot of mosquitoes. An even bigger one are the containers. You can look out around places and say, all right, there are a number of ditches, but think about how many times you've gone along the road and you've seen litter. You've seen bottles dropped. You've seen those little tiny bottle caps from a water bottle that can hold dozens of mosquito larvae. Those are the types of things that you want to pick out. Now, in your own backyard, you could have things sitting there that you might not even think are something that you would have that would grow mosquitoes. So you look, for instance, at kids' toys. And if you have kids or you have grandkids, just think about how many things you have in your backyard that come along with the kids. The bikes, the toys, the bats, the pools, the little cars. All of them will hold water, so what you're going to need to do is turn them over on a regular basis or add little drain holes so the water's not going to sit in them, or engage your kids to turn these items over, especially after a rain. Now keep in mind that especially things like kids' toys, even when you turn them over, there's still nooks and crannies where the water can gather. So if you turn it over, you may need to turn it over more than once, or go out every few days and turn it back over again. Planters, dog bowls, there's a variety of different things in your backyards. I believe I have a list that is just an incredibly long list to give an idea of the types of things. But one thing that we do have in the back, and for folks that may be watching this at home that aren't here, you can either go to our website, I'll have that come up later, or contact our Department of Health. We can get you a home checklist that you can look down. It's a pretty extensive list, so most people will be able to check a few things off just at first glance. That'll give you an idea of types of things you can do around your home in order to be able to reduce the water sources. But if you're talking man-made containers, you're looking at things like cans and bottles and buckets. Here we're showing some water saucers for the plants. Even when you're doing things like bird baths, if the birds aren't in there agitating the water on a regular basis and you're not churning it out and cleaning it, that could be a place for it. I know that the town did a rain barrel presentation only recently, and rain barrels you want to make sure that you maintain in a correct way, or they can become another source for mosquito breeding. If you're lucky enough to have a boat on your property, if you don't have the boat out in the water, or even if you do, you want to make sure you look at the different places there in the tarps and places where water can sit and go. Plastic sheeting, tarps, used cars, old cars in your backyard, and those are man-made things, but let's say you do some really lovely landscaping in your backyard. Rock pools, unmaintained fish ponds, stump holes, bamboo stumps can hold water inside. So you really want to look around your property a little ways, and some of the other things that even the county had just talked about. Pools, ditches, streams, salt marshes, and any place that you're going to see water sit. Those are things you really want to go out. So if you go out and scan your yard, you probably will find a few things. And after garbage day, after recycling day, just make it a regular thing to go on out and take a look and pick them up. A few more pictures of standing water. we're trying to engage folks in neighborhoods and the kids to be able to do this if there's a way you can make it a game, but definitely look in your backyard, because after each and every rain, and we've been lucky, we've been dry for a couple of days, but we had 8 solid days of rain, so it was a joy to go back outside, but it was still a time when we needed to go out in our patios and turn a lot of things over now that it's springtime. One of the bigger things that tend to sit and hold water are the tires. And love tire swings. I think they're great things for kids to sit and play with, but since they're likely to hold the water and mosquitoes can lay the eggs along the sides, you want to put drainage holes in them. You can say, okay, well, I have a lot of tires, what do I do with them? Because I don't have the ability to make a swing, and there's only so many swings you can make with it. We've seen people recycle them and use them as flower pots. There's some lovely ones down on the Township property on Hamilton Street that has done that. But if you say, okay, I want to get rid of them, the nice thing is that Somerset County does have tire recycling days where folks who are businesses or homeowners within the community can drop off unused tires. I believe it's up to 8 tires that they can do. Twice a year at least that they do it. The locations of these are both in Hillsborough, the county garage. Most recent one was in April, but there is one coming up in November. But certainly something to keep track of. Another way to get rid of some other types of things on your property, certainly talk to your garbage hauler or look for garbage collection days or recycling facilities within particular municipalities. Check with Franklin Public Works for what the hours are for the convenience center there. And it's getting to be summertime. I know as soon as Memorial Day comes by, a lot of swimming pools are going to be open. Well, the nice thing is a wonderfully maintained, used, chlorinated swimming pool. The pool itself is not going to be an issue for the mosquitoes. What you're going to be looking for in that are other places around the pool that may collect the water underneath the filter, in the pumps, or with your pool toys. Those are things that are more likely to hold the water. Obviously, unmaintained pools are something you want to look at. They do sell products at online, at home and garden, and big box stores that are biologics that you can put right in that'll help remove the mosquitoes or keep the larvae from hatching. I'm seeing nods over here. These guys are the experts in that one. Now, the other thing I love about this picture are the kids in the little wading pools. While the kids are splashing around in a wading pool, I would love to see the mosquito that can survive that. However, when the kids are done, you really either want to cover the pools tightly. It's not a bad idea to refresh the water if the kids aren't using it daily, or empty them. And even when you turn the pool on its side, be careful that there isn't a little bit of water left down in the bottom of the pool. So again, I said take a look what's in your yard, and the one thing we didn't mention was junk. There probably are a few properties in the town and at places that you've seen where junk is sitting, and those are, again, also places that, well, we don't want for a number of reasons. So property maintenance is a good thing for the value of your home, the good of the value of the community, but also to reduce mosquito and tick habitats. So if you're looking in your yard, you want to make sure anything that you're not using is always a good thing to get rid of, because you can do a bit more enjoyment of your property. So furniture, old mattresses, things of that nature. Franklin Township does have a property maintenance ordinance. You're not allowed to collect junk and stumps and garbage and things like that on your property. So those are things you want to take care of, lest you get a visit from one of the inspectors from the township or from the county. We'll have to give you a notice of violation for that. We'd rather see you take care of the property. But things like that will also help harbor ticks, because if your lawn isn't maintained, if your property's looking a little bit like the picture here, there are enough places where they can kind of sit and hide and grasp onto. Maintaining your lawn is a good thing for, again, aesthetics, to reduce those pools of water for mosquitoes, but ticks are also going to like living in the larger grasses. Now, Franklin Township, where we've got a wonderfully diverse population of all types of God's creatures coming along, and we've seen a lot of deer that like to walk through a number of backyards. Now, deer ticks like to come along with the deer, and that's the one thing that we're worried about with Lyme disease. So if you reduce the grass and the brush on your property, not only are you reducing things for the ticks to latch onto, you're also reducing feeding sources for those deer so that they move on to someplace else. Leaf accumulations, both on your lawn and in your gutters. I think I have a picture of that coming up in a little bit. That will also help reduce the places where creatures are going to accumulate. Mowing is probably your best way of keeping it down. Now, around your house, in addition to the grass, the bushes, the trees, we kind of figured that. But Scott had talked about the different types of mosquitoes and how some like to come on into the house. So there are things within and inside and outside of the house that you can do in order to be able to reduce any of these flying, crawling insects from coming in. Probably one of the primary ones is to put screens on your windows. The weather's starting to get nice, and we like to see people open their windows and get the fresh air in, but take a look at your screens. Are they bound well on all sides? Do they need patches in the middle? Do they have any holes? Because keep in mind that mosquitoes are very small, can get on through that. As it gets warmer out, as much as I like to see people outside and exercising and being active, if you are susceptible to mosquitoes, you may want to stay inside where there's air conditioning, because in that case, the windows aren't open, you don't have to worry about the screens, and you're inside, and that's going to help keep them away. Also with the house, the eaves, the gutters, little things on that can keep the water from draining on down. You'll want to go ahead and repair those. I said, picture the gutter, everybody's favorite job, climbing the ladder, go and reach them out, but even in there, it's amazing the amount of water that's going to accumulate in your gutters, so between that and the downspouts. I know that Glenn had mentioned about the recycling containers. Even though they all the ones submitted by the county do have the little holes in the bottom, the containers that you put in your recycling containers may hold water, so if you keep that outside and county picks up recycling every other week, in 2 weeks, that's a pretty decent population of mosquitoes that can grow in your recycling container. We talked about overgrowth, bushes, trees. Keep things neat, trim, tidy, less places for these creatures to live. Kids' toys, backyard equipment, and mom and dad's toys as well. So if you've got gardening equipment, if you've got hobbies, if you take care of cars, if you're doing things in your backyard, your sporting equipment, just check and see if there's anything there where they're going to sit and hold water. Talked about the convenience center hours. And then also check with your haulers, because a lot of the haulers also for removing debris, they will do it if you call them, and it's not particularly expensive really when you come down to it. But those are things that you can do for the property, but what if you took care of all of this and you're still going outside, or you're going out to the parks, you're going to go hiking, you're going to go traveling, how can you protect yourself from the biting, flying, crawling insects? Now, our source for the best information on this is the Centers for Disease Control, so we followed their recommendations and share that with you. Their suggestion, even as Scott had mentioned earlier, is that you do want to use a bug spray with one of these ingredients, because these are the ones that are most known to reduce the risk and repel mosquitoes. So that would be DEET, picaridin, IR 535, oil of lemon eucalyptus, that's oil of lemon eucalyptus, not the oil of lemon in your kitchen, or paramethane diol. Read the labels of your containers. Since we've started with our Fight the Bite program, my colleagues and I have spent quite a bit of time looking at big box stores and home improvement stores at the displays of bug repellents, and we found there's quite a variety out there. Some are effective, some are not. Even some of the ones that claim they're all natural or just kind of sort of akin to snake oil. We can't recommend any particular product, though you do want to look for something with these ingredients in it. Also read the labels, because some major brands, the blue can might be different from the green can, might be different from the orange can. If you need reading glasses to read small print, I'll caution you, bring it while you're buying your bug spray, because the manufacturers aren't being really good about making it with a high contrast so that it's really easy to read. All right. This, an infographic from the Centers for Disease Control. They do mention some brand name examples, but again, I'm going to strongly suggest to you read the label, because what we found is that some of the major brands that are listed here also have different formulations depending on the bottle that you pick up. So go ahead and read. But there are a number of these things out there. And again, drugstores, grocery stores, your home improvement stores are all now selling mosquito and tick repellents. And luckily, they're also selling it in little travel size containers so that you can bring that with you. Now, when you use these, you also want to make sure that, again, follow the directions. Some of them are not appropriate to use on infants and very young children. Some of them are going to suggest that you don't spray it directly on yourself, but that you need to spray it on your clothes. Varies per the product and per the brand name. Now, an easier way to do it, if you're not so worried about using the pesticides, one of the things we recommend to folks is wear long sleeves, long pants, and socks when you're out walking in the woods, if you're going to go hiking, because this is now a fabric barrier to those creatures. Understanding, though, that when it gets really warm, people aren't going to want to layer up with long sleeves. They do make some lighter weight ones, but if not, then you want to look at some of the other types of things that you can do so far as the mosquito and tick repellents. We talked about mosquitoes, a little bit more about the ticks. I love the first bullet here, but it's sometimes common sense just needs to be reiterated. If you're worried about ticks, you want to stay away from places that ticks are going to live. So that would be places like bushes, high grasses. So if you're going to go hiking on the wonderful Franklin trails, what you want to do is stay to the paths for a number of reasons. It keeps the natural areas natural, but it's also going to help reduce you from having the ticks brush on you. Wearing light-colored clothing when you go out is going to be helpful too, because if the ticks start crawling on you, it's going to make it a whole lot easier to see. I had one lady before the program ask me if all ticks are have this characteristic with the legs, and juvenile ones will not. Or at least they have them, but not so prominently. They're going to look more like little small seeds. So ticks are going to come in all different sizes. So you want to check over yourself, your children, your spouse very carefully when you come back in from very weedy places, very brushy places, because that's how you're going to see it. Check your pets too, because pets can come down with diseases from ticks. Centers for Disease Control on the ticks do suggest that the bug spray for ticks contain 20 to 30% DEET. Again, read the labels and check yourselves over. Another thing we have, either for the folks here or for the folks who want to contact us, we do have a lovely laminated bookmark that shows you how to safely remove a tick should one get on you, and recommend that folks keep that in their Band-Aid box because it's easy to find at the time that you're going to go need it. Franklin does have an ordinance on maintenance of the property, so they do have ordinances that say you need to mow your lawn, you need to take care of overgrown bushes, you need to remove dead trees, you need to get rid of the garbage. If anybody does have issues, you can always call Public Works, call the Health Department to go out and take a look. We do have the ability to issue notices of violation to places that might not be following those ordinances the way they should. What is Somerset County doing? I think Glenn gave a great overview of that, but I do want to remind folks again about the tire collection days. That's in Hillsborough. Next one coming up is November. But if you want to find out more about that, what the county's doing, how to reach the health department, county.somerset.nj.us. At our homepage, you can link either over to the Mosquito folks, you can link over to the Health Department page. We have more resources there, and that's also where you can contact us if you want more materials, and we're certainly willing to do that or come out to talk to groups about similar. And one other place for folks is the Centers for Disease Control. They are the ones that do have the most updated information on all the tick and mosquito-borne diseases. As mentioned earlier tonight, that things are changing as we're learning more about the diseases, so what you heard in March may not be the same as what the recommendations are in June. If you are going to travel, it is summertime. We do suggest that, especially if you're going to warm areas, that you do review the Centers for Disease Control. They do have travelers alerts. They do have information and fact sheets about what to pack, especially if you're young and are pregnant or want to become pregnant. There's recommendations on where you may want to think twice before traveling or what you want to pack with you when you're doing that. And one other way is if you are on the internet and a bit more connected, we do have a presence both on Facebook and on Twitter. You can search for us in either one of those. Somerset County will come up. Those are where we put information even on programs such as this, because we are doing a lot out in the community. And if you do go to some things like the Franklin Flyer Works or Franklin Day or a number of events out there, you may be seeing us out with tables so that you can come over and talk to us and ask for information there. So we encourage you to do that. And were there any questions for us? I know we covered such a wide range of things. I think we overwhelmed folks just a little bit. Plenty of information outside. We'll be here afterwards if folks have questions that they just didn't want to come up in front of the group to ask. On behalf of Somerset County Department of Health and Franklin Township, I really want to thank Scott Kranz from Rutgers and Glenn from Somerset County for coming out and sharing with us. These are the guys that are working at reducing the populations, but also remember, please, you do have a part, and we hope that you've been inspired enough by watching this presentation to go peek outside, see what you have, turn some water sources over, and hopefully we'll all have a much more mosquito-reduced summer. And thank you so much. Have a great evening.